Vanakkam. Welcome to this course on biomedical instrumentation. We have been looking at ECG. We will look at axis interpretation using the Cabrera system, 12 lead ECG, a quick overview of 12 lead ECG, limb leads, bipolar limb leads, augmented unipolar leads, then chest leads, then Einthoven triangle. We will look at all this in this video. So, it is going to be a slightly longer video than usual. So, the heart's electrical axis essentially shows the average direction of the ventricular depolarization, the direction in which ventricles, especially in this case we are interested in the left ventricle depolarization, ventricular depolarization. It is measured in degrees on a circle using limb leads 1, 2 and 3 and augmented leads AVR, AVL and AVF. So, in this case you have AVL first followed by 1 and then AVR. AVR is in a direction opposite, but you represent it using minus AVR, and then limb 2 AVF, then followed by lead 3, lead AVL, lead 1, minus AVR, lead 2, AVF, lead 3. This is the usual method that is used for in the Cabrera system. The normal axis ranges are between 30 and 60 degrees. The horizontal variation is between minus 30 and plus 30 degrees. The left axis, for the left axis, this is the normal axis between 30 and 60 degrees. For the left axis, the deviation is less than minus 30 degrees. The right axis, this is the right axis, the deviation is between 90 and 120 degrees. The extreme right axis, this is no man's land, this is the no man's land, that is the no man's land. The range is greater than 120 degrees as less than minus 90 degrees. Lead 1 is considered to have angle 0. So, that is exactly the x axis. This is lead 1 0 degrees. AVF is 90 degrees. Okay. AVR is actually minus 150 degrees, that is actually 150 degrees, but then this is minus AVR that we are representing here. This is actually opposite to the QRS complex vector. This direction is determined by the positivity of QRS complex in these leads. Which lead is going to have QRS complex positive in which case? So, that direction is determined. Note that the cardiac output, the electrical activity is a vector. It is actually a 3D vector. You are measuring this from various directions. When you compare this situation to a large house, you are having several security cameras. To have an understanding of what is happening around the house, and you are having several security cameras just outside the house, to have an understanding of what is happening just outside the house, it is not enough for you to look at just one camera. You need to have a panoramic view of all the cameras. This is approximately what is happening with the multiple leads that you are having. So, all these leads or each of these leads can be compared to one of the security cameras. Alone they may not provide the full information, but they do contribute something to the total information. So, this is a reasonable comparison to for our better understanding. So, these leads record electrical activity using the electrodes placed on the body. One lead is essentially a specific electrical view of the heart formed by combining signals from sometimes 2 electrodes, sometimes 3 electrodes. Okay. The standard 12 lead ECG actually uses only 10 electrodes. It uses 6 precordial leads and 6 limb leads, and these 6 limb leads are formed by using only 4 electrodes. Okay. Note that the 6 precordial leads are the unipolar leads. Lead 1, lead 2, lead 3 are bipolar leads. These measure the difference between 2 electrodes, differential. These measure the difference between 2 electrodes, opposite polarity. Yes. Unipolar leads are those that use one positive electrode and some central reference point. You are not subtracting one from the other, but rather you are comparing the activity in one electrode versus some central reference point. This is the precordial leads and the augmented limb leads. So, essentially your 12 lead ECG will have 3 bipolar limb leads, those are lead 1, lead 2 and lead 3, and 3 unipolar limb leads, these are the augmented limb leads AVR, AVL and AVF, and 6 chest leads are the precordial leads, those are unipolar, those are V1 to V6. Each of these lead essentially provides a unique view of the heart. This is like having one camera in front of the house, one on the side, one on the back, another on the other side, another from a top view and so on. Each of this provides a unique view of the house, your security cameras. Likewise, each lead provides a distinct and unique view of the heart, thus helping us in accurate diagnosis. So, it is not like one lead is more important than another. All of these leads contribute to the total diagnosis. So, what do these leads represent? Let us first look at the limb leads. The limb leads essentially record the electrical activity or view the heart's electrical activity in the vertical plane, the coronal plane. So, the inferior wall of the heart leads 2, leads 3, lead 2, lead 3 and AVF, and the high lateral wall, these are viewed as in lead 1 and AVL. There are two types of leads, we said among the limb leads. There are 2 types of leads. These are bipolar leads, lead 1, lead 2 and lead 3. Each of these has a positive electrode and a negative electrode. So, what are the electrodes for lead 1 and what are the electrodes for lead 2 and what are the electrodes for lead 3? There are only 3 possible combinations. Right foot, we will come back to that later. There are only 3 possible combinations. We use 3 limb leads, 3 limb electrodes, right arm, left foot. These are the 3 electrodes that we place, and then you have from these we compute lead 1, lead 2 and lead 3. The unipolar limb leads or the augmented limb leads are the so called AVR, AVL and AVF. These essentially use a single electrode with reference to some central terminal, Wilson's central terminal, which is essentially a combined signal from all the 3 leads, leads 1, lead 2 and lead 3. From all of them you have a central point, and this central point, this central reference point is called as Wilson's central terminal, terminology. AVR essentially refers to the right arm, AVL refers to the augmented limb lead from left arm, AVF refers to the augmented limb lead from the foot or the left leg. There are 2 feet, but the right feet we will look at later. Okay, right foot is used to drive the system, to provide feedback into the system. That is a separate lecture on that topic. That is not considered, we usually do not, it need not be always placed, this electrode need not be always placed. So, the usual 12 lead ECG that we discuss will have electrodes in the right arm, in the left arm and in the left foot. When you simply say AVF, you are referring to the foot, but then there are 2 feet. Of interest is only the left foot, of course, in ECG. Lead 1 essentially looks at the heart from the left side, right. That is the information that you take from the right arm to the left arm. Limb lead is electrode data from left arm minus the right arm. Positive is the left arm and the negative is the right arm. This is limb, this is lead 1. Note that this is a bipolar lead, so that there will be 1 positive and 1 negative. Negative electrode is on the right arm and positive electrode is on the left arm. Lead 2 looks at the heart from the bottom left. Right. This, in this case, the positive electrode is on the leg, is on the left foot. This is the positive electrode, and the negative electrode is on the right arm. Okay. So, lead 2 is the potential on the left leg minus the potential on the right arm. So, that. Lead 3 looks at the heart from the bottom right. In this case, the positive electrode again is on the left foot, the negative electrode is on the left arm. Okay. So, lead 3 is ELL minus ELA. ELA is essentially the electrical potential at the left arm, ERA is electrical potential at the right arm, ELL is the electrical potential at the left leg. Right leg is used as the ground reference to reduce interference, and that system we will later call as the driven right leg system. We will discuss that in a future video. So, these essentially define the first 3 leads. Note that one lead in this is composed of 2 electrodes, because this is a bipolar system, 2 electrodes. Each lead is composed of 2 electrodes. There are 3 electrodes of interest in this case, and we have 3 possible leads in the bipolar configuration. But then what I can also do is I can combine information from all the 3 at a Wilson central terminal and then measure from one of these 3 terminals. That is called as the augmented limb lead or the unipolar limb lead. Note that when you say bipolar limb lead, you are referring to lead 1, 2 and 3. So, the augmented limb leads or the unipolar leads are AVR, AVL and AVF. AVR refers to the right arm, AVL refers to the left arm, AVF refers to the foot, but then in this case we only consider the left foot. In this case you combine two of the standard limb leads to create a virtual ground or a virtual electrode. For example, if you take AVR, this lead essentially looks at the heart from the upper right. The positive electrode is on the right arm. This is AVR, the positive electrode is on the right arm, and then you compare this with the, there are these negatives are kept here, there are two negatives here, see, there are these two together essentially constitute the negative. AVL looks at the heart from the upper left. In this case, the positive electrode is on the left arm. AVF looks at the heart from the bottom, from the bottom. I am looking like this. Right. In this case, the positive electrode is on the foot, and there are two negatives. You compare it with respect to a common ground. So in each case, one of this electrode, you are measuring from one of the electrode, and the other two essentially create the common ground, together form a common virtual ground or virtual electrode. You measure with respect to that common reference point, which is why these are called as unipolar leads. Eindhoven came up with these representation of the ECG in 1800s, late 1800s I think. Please check this. So that is why this triangle is called as the Eindhoven's triangle. Eindhoven's triangle essentially represents the electrical activity by using the three bipolar limb leads. What are the three bipolar limb leads? Lead 1, lead 2 and lead 3. This is essentially formed by the electrodes on the right arm, on the left arm and the left leg that is surrounding the heart. The Eindhoven's law is the following: if the electrical potential of any two of the three bipolar leads are known at any given instant, then the third can be computed by mathematically or algebraically summing. These are vectors. So you have to sum algebraically summing the first two, or the sum of the voltages of lead 1 and lead 3, lead 1 and lead 3 together, you get lead 2. If you sum lead 1 and lead 3, you get lead 2. If you look at this triangle, that makes sense from this is also called as a triangular law of vectors. If these are vectors, if lead 1 and lead 3 are vectors, then together they will, if you add them, you will get lead 2 is the law of vectors. So this is the Eindhoven's law of cardiac function of ECG. Then you have the chest leads. The chest leads essentially provide a different perspective. They provide a horizontal perspective from which you can look at the heart. Please note that earlier the AVL, AVR, AVF and the three leads are going to provide the data in the frontal coronal plane. This is going to provide a horizontal perspective at the heart, essentially provide lateral, anterior, septal and posterior views. So the six chest leads are placed such that they provide these views for us: lateral, anterior, septal and posterior views. And it is quite easy to remember their names because these are essentially V1, V2, V3, V4, V5, V6. And there is a particular place where you keep them. These are the fourth intercostal space right of the sternum. V1 is placed in the fourth intercostal space right of the sternum. V2 is placed just left of the sternum in the fourth intercostal space. V3 is placed between V2 and V4. V4 is placed at the 5th intercostal space along the mid clavicular line. V5 is placed in the 5th intercostal space along the anterior axillary line, and V6 is placed in also in the 5th intercostal space along the mid axillary line. So, this means that V1 and V2 will provide septal and posterior wall. V3 and V4 will provide anterior wall, front, posterior means back. V5 and V6 will provide lateral wall of the left ventricle, because they are on the side. They are going to provide view of the lateral wall of the left ventricle. These are the 6 unipolar chest leads or the precordial leads. This is also called as the precordial leads. They are unipolar and measured with respect to a reference point. Okay. So, what we have seen so far are the axis interpretation using the Cabrera system, a quick overview of the 12 leads of ECG and the limb leads, lead 1, lead 2 and lead 3, the bipolar limb leads, that is lead 1, lead 2, lead 3, 1, 2, 3, augmented unipolar leads AVF, AVR, AVL, and then the chest leads V1 to V6 and the interverse triangle. Note that the heart dipole activity is, the electrical activity of the heart can be represented as a dipole, and usually the direction of the dipole is going to be most aligned with this. Why is that? Because in the heart, this is where this is very crude heart. This is where the sinoatrial node is, and from there the AV node, from there the left ventricle. So, that lead that is having direction similar to this is the one to which the heart's electrical activity vector is going to be most aligned, and that, it turns out, is actually lead 2. In resource constrained situations, if you do not have other leads, if you only have 4 electrodes, many times it is enough to measure only from lead 1, lead 2, lead 3 in resource constrained situations, of which lead 2 is among the most informative. That does not mean that the others are not informative. It just means that this is going to provide the most aligned view with the heart. Okay. Also remember that lead 2 essentially the sum of the lead 1 and lead 3. Remember, that is the interverse law and the interverse triangle. Okay. So, with this we come to the end of this video. Thank you very much for your attention.